TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Well, welcome
Thank
to Open
you.
Mind Insights. We are so excited to be speaking with you today and building off the conversation you had with all of our experts at the think tank yesterday.
Yeah.
And just it's such a pleasure to know you and have witnessed your work in Sacramento for the last 15 years with NAMI California. You are the CEO and you've done so much in that time. And I really want to dig in, get to know you a little bit more, and just share your insights with our audience.
Well, thanks for having me. I'm excited to be here.
Yeah, wonderful. So, first question always has to be like who you are as a person. Like, what brought you to this work?
That's always such a good question. I didn't know NAMI before I even interviewed for NAMI. It was very serendipitous in how my path led me to where I am. My educational background is I have a master's in public education, administration with a health services emphasis. So I always thought I wanted to do like hospital administration or something along those lines. Um, my work background has always been in nonprofit or association work. And so I have a lot of experience in the political realm and the fundraising and running operations for nonprofits. But it wasn't until 2009, right after I had my daughter, um, where I was just trying to figure out what I wanted to do again. You know, as a new mom, you kind of start to shift your mind of, do I really want to be this working woman and
Yeah.
hitting the pavement, or do I want to kind of take a step back? And so I started interviewing for jobs, and I happened to get an interview with NAMI California. Um, and when I was in the interview and researching the organization, I thought, wow, I had no idea who this organization was. And I happened to cry in my interview.
Oh my gosh.
Yeah, because
Wow.
my mom was actually in the psychiatric hospital at that time.
Oh,
So it was Mother's Day of 2010,
gosh.
that we had to 5150 her for the third time.
Mm.
And I just remember sitting in that interview thinking, how did I not know that this was available to me as a family member? This resource was available to me as a family member. And I knew right then that no matter if I got the job or I didn't, and of course I'm crying in the interview, so I didn't think I was going to get the job. And so it was just like, this has to be an organization that I uplift in some way. And so that's kind of been my driving factor, was just, I remember when my mom was very first 5150, her first psychotic break wasn't until she was in her 50s.
That's a
Um,
little, is that rare?
um, no, because psychotic breaks happen along the lifespan,
Okay.
right? So she had an undiagnosed mental illness for obviously 50 years of her life. And so it just happened to be different life factors and life things happening. Um, I was in college still, and I have sisters that are about 10, 12 years younger than I am, and they were still living at home. And I went to go pick them up, and my mom met me at the door and she handed me the phone, and it was the Heritage Oak Psychiatric Hospital on the line.
Mm,
And they said, your mom has called us because she's fear of taking her own life. And so we would like for you to bring her in right away.
mm.
And it was in that moment, I was 21 maybe,
Oh, wow.
that went from being the daughter to the caretaker
Oh
right
my
away.
gosh.
So I drove her to the hospital and got her checked in. And I just remember sitting in a room, very small, like fluorescent lights, no windows, waiting for somebody to tell me something. And I
Mm.
remember like a social worker kind of pop their head in and be like, everything's good, your mom's good, we'll be back in a minute. And I just remember feeling lonely and lost, and, like my mother, who I looked up to as my hero for so many years, um, was in need, and I didn't know what to do. I didn't know how to help her. And so kind of my plans and everything shifted at that moment. I was looking in grad schools and going in to one in London or in Boston, and um, I stayed home and took care of my sisters and took care
Wow.
of my mom. And it was just kind of, it's been a journey since then.
Mm.
And so I got into this work just by happen chance. And so it's been my mission to make sure that no family, when their loved one is going through that sort of crisis, feels as alone as I felt in that room in that moment.
Oh.
And then, of course, as we've grown over the last 15 years, other things have come across in our world. And we always say that you never can escape, nobody can escape mental illness. There's 1 in 4 people who experience in this world. And I would argue that that number is higher because the family really experiences it.
Absolutely.
The
Yeah.
person may have the diagnosis, but those caretakers and those people who are there for them are really the ones that are absorbing a lot of their pain and then the trauma that it causes with a broken system and just the illness in and of itself. And then you add substance use to the mix, and unfortunately, my children have also not been able to escape that as well. So, with their own dad. So,
Yeah, yeah. So that's an important point with the statistics, really, that everyone is touched by
hmm
this issue, either for themselves or someone close to them.
hmm
Um, which makes me wonder why there is such a stigma surrounding it.
Well, I think that, I mean, the stigma obviously stems from the history of how we've treated people with mental illness throughout, the years where we would hospitalize them. A lot of times they were women and they would just be able to be hospitalized in the state hospitals if, they were having an emotional mood swing. It was so easy to do that.
Mhm.
And then we would heavily medicate them, and um, that would then turn them into, a lot of times, especially the drugs, a
Mhm.
long time ago, would just turn them into mush.
Oh.
And so I think over the years, the stigma was just you didn't want to be crazy. You didn't want to be labeled in any way. And so we've fought a long time to say to people, that when you have a mental illness, it's not a weakness in any way. It's just a illness that is just like if we were to have diabetes. It's something that we have to take care of. It's something that we have to manage. Um, and it's not something that you need to hide. And
Mhm.
so I do think that the stigma comes from the lack of wanting to speak out about it. And then you can go, usually the average is 7 to 10 years before the first onset of a symptom to actually getting and receiving treatment. So, in that 7 to 10 years,
Mm. Well,
think about how much you just deteriorate and you're not getting and
that's
receiving the help,
true.
and it
Yeah.
just becomes a cycle. And so,
So if you catch it earlier.
yeah. And so it's literally been I was like catapulted into this industry by luck, a serendipity of how I got here. But what drives me is the continued push to make sure that people and families don't have to feel alone. That I tell a heart attack story all the time. I think you probably heard me tell it, where it's like if you're on the street and you see somebody who has a heart attack, our first instinct is to call 911. We run to them, we hold their hand, we're very compassionate. The response is usually an ambulance.
Mhm.
And then they take them to a hospital. And even though it's very scary for the families, they're able to sit by their bedside. They can talk to their doctors about what it is that they feel that could maybe have been an onset to this. Is it what they're eating? Are they exercising? Um, and no matter where their treatment is in the hospital, when they get out of the hospital, family is always included in that conversation. There's a treatment plan between the hospital and the doctor, the cardiologist, and they really do everything that they can to prevent that person from having a heart attack again. Well, when somebody is having a mental health crisis on the streets, we usually run from them. We don't say anything, or we dial 911, and then law enforcement will usually come with guns drawn, scaring everybody and that person as well. Um, if we're lucky enough to not get them in handcuffs and can get them into an emergency room or a 5150, usually they're sitting in an emergency room for 3 days, 72 hours. If they can get into a treatment center, if there's a bed available, their family is not notified, their family is not talked to. If they get into a hospital, it's behind a locked door. And depending on their stay, their family is not involved. There's no kind of inclusion of how, when they leave, do we make sure that they don't come back, right? Or what is the treatment plan? Can we connect you with a psychiatrist? It's like, do you have one? Yes? Okay, great. You should probably call them. Some great program, there are great programs out there, but it's just not the norm. And it's
Yeah.
just how we as a society treat people who live with a mental health condition. And then unfortunately, the door just goes back and forth. I mean, my mom had been in and out of hospitals, for years. And luckily now she is a success story in a lot of ways. Like, she is healthy, she has her medication managed. There are still times when she has her ups and downs, but she has everything kind of managed appropriately, that she hasn't had to go back into a hospital for decades. So it's great. But that's not the case for everyone.
Yeah, and I'm sure having the family support and the knowledge has been part of the success.
Oh,
for her.
absolutely.
Yeah.
Yeah, but it's not without its struggles.
Yeah.
Families, I think, oftentimes, and I had to deal with this with my mom, and even my ex-husband. It's we want what's best. We see what's happening to them. It's killing us for somebody that we love so dearly to watch them go down a path. And a lot of times families will get isolated by the person who is living with a behavioral health condition, villainized a lot of times, and all we're trying to do is just support and help the individual that we love so dearly get what they need. And so it's so important that families get the education that NAMI provides about
Yeah.
what now,
Yeah.
what is your role? What
Mhm.
can you do? What are your rights? What are their rights? How do you help them with their journey? But also, like, how are you taking care of yourself?
Yeah, it's huge.
Because it will ruin you.
Oh my gosh, that's a
Mm,
powerful statement.
yeah.
So going back to, that moment in your interview, first of all, what position were you applying to?
I applied for the deputy director
Deputy
position
director.
because it was like a part-time at that time. And
Okay.
I wanted to be a mom. And so I
Yeah.
was like, this is perfect. Like, I can still have the kind of power role that I
Yeah.
knew, like, I came from and what I wanted, but not all the responsibility. But then
Yeah.
within 6 months, it shifted, and that CEO at the time was removed, and they put me right in as interim, and then it kind of was just
Yeah.
history. So
Yeah. But I find it interesting because I know your organization. I've had the opportunity to speak with various members of your
mhm,
staff and noticing that the culture is different, that
mhm,
you really practice what you
mhm.
preach. The workplace environment is completely different. So when you say I cried in my interview and didn't think I would get the job, from what I know about your organization now,
Mm,
I would say that makes sense that you
yeah.
would get the job.
Yeah, I mean, I think a lot of people think emotions are weakness, and I'm so grateful that I was able to get that position and to be able to lead in this way. And I was 15 years younger at that point. I was still like learning myself and um, learning my leadership style. And for me, the ups and downs of the leadership styles and having to be a woman in a political field of a
Mhm.
lot of men, and having to, like, kind of jockey my way into saying NAMI needs to be at the table. NAMI's been around for 40 plus years, but when I started, we were kind of these rebel rousers, and I love our history.
Yeah.
It's like moms who were just fed up, and because they were to blame. Doctors would blame moms.
Oh, that's right. Yeah.
Yeah, so, like, if they're 40 plus years ago, their son was diagnosed with schizophrenia, the first thing the doctor would diagnose them is, do not go to your mom. It's your mom's fault. And the moms were like, whoa, hold on just a minute. This is not because of us. And so that history of kind of being these rebel rousers, of we won't take no for an answer. I love it. It's within me. It's like my fight within me. But I realized and recognized that NAMI wasn't where we needed to be. We needed to be the leading voice. We represent families and the individual. We represent the stories. We represent the experience. We are experts out of our own experience. There's no book that could tell you and teach you what our heart has had to overcome over the years. And so it was just so important for me to make sure that we were the leading voice in mental illness, especially when it comes from the lived experience lens. And so it was so important for me to figure out the best way for my leadership style to kind of get to that point. And it was hard, like many young professionals, you have to learn
Mhm.
um, who you can trust, who you can work with. But for me, it was all about collaboration. For me, it was about leading with love and leading with the heart that is what got us to where we're at.
Yeah, yeah.
So it was partnering with people like Robert, and that was the big thing I changed the most in my initial years. Was I wanted to make sure that people who are on our board of directors, the leaders who actually drive the organization, represented varying different sectors that
Mhm.
touched mental illness. And in doing that, I've gotten to meet and have mentors like the old commissioner of the CHP,
Oh, wow.
the director of UC Davis's Reducing Disparities, and a leader within the World Health Organization on reducing disparities, and people like Robert, who are so passionate about bringing primary care and psychiatry together because he sees that vision of that need.
Mhm.
People who work in the state, in the Department of Education, and young people. So, who is it that we can bring into our organization who can help change it and shift it? And that's about collaboration. And
Yeah.
it's about building leaders within.
Yeah, and you've got this overall vision and this drive that comes
Mhm.
from personal experience, and I'm guessing from being a mom,
Yes.
because when you're a mom, that mother bear that comes out, right? That
Yeah.
like, you know,
Yeah.
we're gonna do this thing.
Yeah.
Um, but I want to dig in a little bit more into your work in the policy side and this concept of kitchen table to capital
Mhm.
and what that means to you, and not just what it is, but exactly how do you accomplish that? Because
Yeah.
that sounds really hard. Like you're
Yeah.
going into completely different environments to
Mhm.
listen to those with lived experience and then going into a completely different environment in politics and trying to make it all work together. So tell me about that.
Yeah, I mean, it's a powerful dichotomy of y- listening to the community, hearing the voices. So, again, we are experts out of our own experience, and what drives our organization are those stories. A lot of the work that we do in policy is really from hearing from our families of what they're not getting, what they're having a hard time working with people. We don't do at NAMI California direct service. So, I'll get emails sometimes and say, like, here's what's happening with my son or daughter. Can you help? And unfortunately, that's not my position. I want to. I always direct them back to our local affiliates who do this support work. But what we do at the state is we really listen to what are the cracks in the system? What are these gaps that people are falling through? What is that Grand Canyon of what's happening in my home to what's the service that's getting provided and that treatment that I need? And that's where we hear those stories of, this policy is being changed by my board of supervisors and it's going to mean this. For instance, we have right now in Sacramento County, and it's flooding to other counties where our sheriff is responding to a Ninth Circuit court ruling that law enforcement officers who respond to a 5150, release the liability, so that officer will be personally liable if something were to happen. The officer involved shooting or something like that. So Sacramento sheriffs have decided they're not going to go out to 5150s that are not like imminent danger, basically, which is a struggle because our families are, well, who are we going to call? There's 988 and there's some great services. And, Jonathan, who oversees well space in the Sacramento and the 30 counties around Sacramento, does a wonderful job. But even the services that he's able to provide, lay families, myself included, I had to figure something out a while ago with a family member in Sacramento, and I didn't know who to call. I'm in this world and I don't know who to call.
Oh my gosh.
I'm lucky because I can pick up the phone and say, who is it that I can,
wow.
where should I
It's telling.
go?
Yeah.
So we hear these stories, and I hear these parents that are frantic about, who am I supposed to call? If I call 911 and my son or daughter's in a psychotic break and I don't know how to calm them down, law enforcement's usually the first to respond. Are they the best to respond? Absolutely not. But they're usually the first to respond. And so now we're having this lag of time of response and trying to figure out who it is. And unfortunately, the worst case scenario happened where Sacramento had this in place. It was, we're not responding. They went to 988. 988 dispatched a county mobile crisis response team. They didn't show up. So it's kind of like passing from sheriff to 988 and then passing to the county, and then one of them drops the ball. Unfortunately, the person actually died by suicide. And so it's the worst feeling you could possibly have as a parent. It's the worst feeling you could possibly have as an advocate, where you're trying to find the solution to an issue like this. And it's kind of like, whose fault is it? And so my advocates are calling and bombarding and saying, we have to change this. We have to figure this out. So then my job is, okay, how do I translate their stories using the powerful, story that they have, those feelings that they have, without scaring people who might think, oh, again, this is just overreaction, or no, this is not the true story. Well, it is the true story for somebody, right?
Yeah.
And so it's my job really to translate from the kitchen table to the Capitol. How do we make sure that what is happening in real life to families doesn't happen to another family, but how do we, in the best way possible, change this system? And the hardest part is then that middle part between the kitchen table and the Capitol, because it is trying to get that story out. It is trying to also help my advocates understand that there is a process, that unfortunately things don't just change in a heartbeat. And that's the saddest part, is that how do we change a ship from, turning around? It's slow and it's painful. And so a lot of the other translation I do is translating from the Capitol to the kitchen table. If a policy is passed and signed into law, my job is also then to translate back to my advocates, to my affiliates. What does that mean in your area? This law is passed at the state. How is that going to affect San Bernardino? And what can you do as an advocate to ensure that that is actually happening? And if it's not, how do you talk to me about it for us to make sure that we're making those changes? So
Yeah.
a lot of communication, a lot of collaboration, a lot of translation.
Probably a lot of meetings. I mean, how do you gather this information? How do you, because you're like the bridge between these two things and speaking different languages back and forth to each other, but like, nuts and bolts, how do you get, like, are you sitting down with these folks and actually listening and then sitting down with these folks as well? Or are there intermediaries, or how does that work?
Yeah, I mean, we have a wonderful staff at NAMI California. And so we do a lot of listening sessions, and our staff is, I mean, when I say they're incredible, their hearts are just so open and
Oh, yeah.
pure for this. You
Mhm.
know, you've met several of them. They're just amazing individuals. And so they do a lot of the listening sessions. So we have various different sectors and various different kind of target markets, so to speak. So we have the general population, families and individuals. So how do we hear that message and give a message? Then we have our local affiliates who are more of the boots on the ground business. We need to serve these individuals. And then we have who are our partners, who are the people that are impacted by mental illness every day, teachers and law enforcement and hospitals. And then we have kind of the political realm. And so all of our different messages and how we speak to everybody is just so different in how we gather information and how we get information back to them. And so a lot of our work is with experts in not only those areas, but within our staff. So they build relationships. It's 100% relationships that we have.
That's a lot.
Yeah, and luckily for me, I always say that I'm an introverted extrovert. Like I am usually pretty, like in my personal life, kind of a little bit more just like homebodied and guarded a little bit. But in my professional life, I get those juices from meeting people and hearing from people. So the think tank yesterday just gave me so much energy because I was
Mhm.
in a room of some brilliant minds, some who I haven't met, and I got to hear and listen and absorb their information.
Yeah.
So it's different strategies for different target markets, lots of meetings, but lots of partnerships. My board of directors, like I said, is a bunch of different people who have differing backgrounds, and they do a lot of that work too. I get to hear what's happening in, you know, the from the DA of Ventura County and what's going on in the courts because he's on my board. And we think of what are some issues that are happening there and how can I then go back and ask my members, is this what's going on? What are some best practices happening in your area that we can maybe take elsewhere? Using regional meetings, using our big conference, you know, just I think it's just kind of a strategic approach
Yeah.
that luckily again I have a master's in public administration, but my undergraduate is in communication, so I have a little bit of knowledge, although it was 20 plus years ago and the
Yeah.
communication world has changed
For
so
sure.
much since then.
Yeah, absolutely.
But the strategies haven't
Yeah.
it's just how the message is getting out that's changed, but the strategies of communication, interpersonal relationships,
Relationship
those
building.
things
Yeah.
haven't changed.
So, what would you say that you've learned, over the years about, and since it's been 15 years now, you've seen, kind of the conversation shift
Mhm.
and change over that time. But looking forward into the future, um, what have we learned? What can help us inform moving forward? What solutions do you see would be valuable in, making a better world for those with mental illness and those supporting them, which is kind of all of
It's
us?
all of us. It is all of us. I would say the biggest change when I first started till now is the collaboration piece. In the mental health space, and it still happens a little bit, it's just not as bad. There are still some kind of like uh, bad players, I guess you could say, that, or people maybe who come from different sectors. But we have, over the last 15 years, really made a point to we can only do this if we do it together. And so 15 years ago, the mental health communities were fighting each other,
Oh.
whether it was for dollars, because, 15 years ago, even though MHSA was around, it was still kind of new. It had just passed like 5 years prior. So they were just starting to like get the regulations still in place and
Hmm.
figure out how the money was distributed. And um, we were kind of always at odds with each other. It was like the families were fighting the peers, who were fighting the providers, who were fighting the
Mm,
politicians. And so,
mm.
since then, I would say the biggest change is being able to be in a room with people who have varying different viewpoints and realize and understand that we all want the same thing.
Mm. That's so
We
important.
do. We
Yeah.
all want the same thing. We might have different sticking points, but in the end, we want to ensure that people who are living with a mental health condition are receiving compassionate, appropriate care that is driven by them. We want to ensure that families are involved so that they can provide the support that that individual is going to need. We want to make sure that access is free and easy and accessible, that there's no wrong door that anybody can go through. We all want that.
Mm-hmm.
So, having more of these conversations where we get together and we think we have more alike than we do different is what's going to move us forward in the future. And I think if you talk to, when you start talking to a lot of the people that you're going to be speaking to, we all will say, like, our system is broken. And I read back on the history of NAMI California because I'm so grateful that they wrote it down. I need to do a better job of that too, and that's why I want to work with you. Is like we need to write down not only what happened, but what has happened over the last 15 years too,
Mm-hmm.
and
Mm-hmm.
how do we kind of have a historian who can tell that story? But when I read the stories that were written, the fights are still the same fights, and that makes me so sad.
Wow.
But
Yeah.
what's different is it's not just NAMI fighting this fight. Now it's like NAMI and friends.
Mm.
And we are all part of the same army. We are all linking up arms and walking into the battlefield together.
Mm.
And we might have different strategies in getting what we need for our own constituents, but the outcome is the same.
Yeah. Yeah. That's an important insight.
Mm-hmm.
It's so interesting how things can be so complicated, but at the end of the day,
So
the big
simple.
picture is so simple.
And a lot of us sitting in that room even yesterday are just like, we just want to blow up our system and then like put it back together.
Yeah.
And I mean, I say it, I probably say it on a monthly basis, just like, God, I just want to blow up our system and then figure out what's right. Because in policy and politics, you're like putting band-aids on things. You're
Yeah.
trying to fix current language and law that's in place. And that's not going to solve the actual problem. And it's probably my most frustrating part of the work that I do is
Yeah.
not being able to just say,
Scratch
let's
that,
just,
start
like
over.
scratch that. Let's think about the current landscape. Let's think
Yeah.
about all of these new factors. Let's think about AI. Let's think about how,
Yeah.
behavioral health is affecting young people and how they receive information and how they get
Yeah.
information and how it's so different than like the LPS Act was written 60 something years ago.
Mm.
Like how
Yeah.
how are you supposed to change a system that is so different but so the same? Like we're not going to get any movement if we keep just trying to fix a system that is so old. It has not a lot of relevance.
It's really hard.
Yeah.
It's really hard.
So it's frustrating.
Yeah. Yeah.
So I'm hopeful for the future. I mean, for those who were in the room yesterday, my daughter was there and like I'm so
Nice.
proud of her, but she is so passionate about this topic and just changing things. And I hope that our young people are able to have a very different path. It's what drives me.
Yeah.
Yes, it
And I
is.
see it.
Yeah.
I see it in the schools.
Yeah,
When I go into the schools.
it's
Like
changing.
it's a conversation. It's, mental health breaks or a
Mhm.
wellness room or
Yeah.
space to talk. Like young people are talking
Yeah.
about this and they definitely were
Not
not.
when we were, yeah,
No.
not when we were
Like,
young. And you know what my hope is and what continues to drive me to do this work is, and I've always said this, that it is my kids. It is the fact that I want my kids and the kids of the future to have a very different road that they can go, a different road. Like if we're all going down this road, they need to turn and they need to get off of this
yeah.
road and
Yeah.
onto a new road where the journey of getting and accessing and talking about behavioral health, substance use, mental illness is early
Hmm.
and normal
Yeah.
and something that can be identified and talked about without, so it doesn't like ruin relationships and ruin that individual's life, but then, the ripple effect of it
Yeah.
around. So I always say that my kids are what continue to drive me to do this work. My mom is
Yeah.
what kind of
Got
got
you
me
there.
into it. I've had to struggle with my own mental health issues from the trauma that I had as a child, from living with an addict in my own home. Um, I'm lucky that I'm able to have a great therapist and good support, and I have no shame in talking about it because it's a badge of honor that I wear, that
Yeah.
this is something that I have had to overcome. It's not something that I will hide ever. And so if we can make that change so that my kids, my daughter's my age, sitting
Yeah.
here in this chair, wherever she happens to go, that's going to be much bigger than me. And same with my son, like they can have these conversations and tell a different story, then I will have felt like I've done my work.
I think I think there's a great chance. Yeah, absolutely. We're all coming together to do this. Now, if somebody wants to join with NAMI,
Yes.
link arms with NAMI California,
Mhm.
how would they get in touch and get involved?
I think the best place to start is our website, which is namica.org. If you live in California, it's the best place to start. If you want to become part of our army, there's ways to advocate, how to get involved, sign up for our newsletter. If you just need supports, you need a support group, you want to learn about mental illness, you want to get something in your schools, it's a great place to start as well because you can get connected with your local affiliate as well. And it's my job to say to people, you should call NAMI. It's also my job to make sure that there's a NAMI answering the phone on the other end. And so
Mm,
if that is not the case, then people can reach out to me directly, and I'm happy to make sure that they get to speak to somebody that they need to speak with.
wonderful. Thank you
Mhm.
so much. Thanks for sharing your wisdom and your
Yes,
journey with us. I really appreciate it.
happy to be here. Thanks for doing this work. It's incredible.
You're welcome.